Just like when administering oral medications before, when removing medications from a vial, we need to make sure our equipment is ready and we begin our 3 checks. So in case we forgot, our 3 checks consist of checking our prescription or order rather against the medication. So our medication like against the MAR, and our medication against the order. So whenever we have our medication to begin with, in this case a vaccine for example, we would check it against the order. So if a doctor ordered the Tdap injection, we would make sure that it was in fact ordered as a Tdap injection. So then we would pull out the Tdap injection, and then once we had the Tdap injection, our second check would be that we had the correct dose of the Tdap injection. That would be our second check. Our third check would be that we were given the Tdap injection to the correct patient, and we would check that by making sure that the correct patient had the correct name and date of birth, and those would be our 3 checks. So I just wanted to clarify that and just make sure that I hit those 3 checkpoints. So once again, that is highly, highly important that we do those 3 checks, especially when, even when removing medication from a vial. And that is highly important. Also, it is highly important to remember the steps when remembering to give any type of medication. It's important to know the actions, special nursing considerations, special safe dose ranges, the purpose of administration, and the potential adverse effects of that medication. Also, the appropriateness of the medication that the patient should, be considered. And make sure to do hand hygiene before removing any medication from a vial. So after unlocking the medication supply drawer, you're going to have your medication in hand, and I'm going to make sure that I prepare 1 medication at a time. That way I don't mix up any medications. Also, I want to make sure that I am doing my second check here by verifying my label. Like I said, make sure I have the correct vaccine and the correct dose. So I'm going to do my second check. I don't actually, where I'm at home now in quarantine, I don't actually have a vial to draw from, but I did get a picture so I can kind of demonstrate what I am doing. So I just printed it off of Google here to show kind of what I'm talking about. So this is actually a vial. I don't know if you guys can see it. So what I'm going to do here is, this is a vial. This will be the seal. So whenever I'm doing this, I'm going to pop the seal. This could be metal or plastic. We'll do hand hygiene, put on gloves, pop the seal off, and then you're going to take an alcohol pad and you're going to clean this in a circular motion. And you would make sure to allow that time to dry. Okay? So once you remove the cap from the needle by pulling it straight off, if it's a multi-dose, make sure to only touch the plunger at the knob and draw back the amount of air to the syringe. That way it's equal to the specific dose of the medication needed. If it's a single dose, no air is really needed at all. But whenever you pierce the vial at the top, and you're going to hold it to a flat surface, and that little self-sealing top up here, it's going to, in the center of it, right here, you're going to pierce that vial, and whenever it's on a flat surface, and with the needle, and then inject the measured amount of air if it's a multi-vial solution. But you do not inject air into the solution, just above the solution. Once again, if it's a single dose, no air is really needed be injected at all. And once the air is instilled and injected, you're going to invert the vial. That means tilt it up like this. So you're going to invert the vial and keep the tip of the needle, otherwise known as the blunt cannula, above the fluid level. So you're going to hold the vial in one hand, and the other one, so pretend like my finger here is the syringe. You're going to hold the vial in this hand and the syringe in this hand, and then you're just going to kind of like suck up the medication from the vial here, and then you're going to draw up the prescribed amount of the medication while holding the syringe vertically at the eye level. And then any air bubbles that might accumulate at the top of the barrel of the syringe, you're just going to kind of move those once you get that out. So once you draw up the amount of air, you're kind of just going to like bring it back down here, and you're like set it back down flat. You're going to pull out your needle or your syringe like this, and you're going to put that back down, and then you'll see the air bubbles, so you can kind of like flick your needle like this, and then you'll see those air bubbles go here up at the top. So that was kind of just like to demonstrate what an actual vial and topper looked like. But actually, luckily, I have a 1-year-old and I have Tylenol in this syringe, and luckily this Tylenol has a little hole, so it I actually have to draw it up, and it draws up like a medication. So I'll draw up 1.25 of that, and so that is kind of invertedly, and then I would flip it back over like this, pull that out, and then if there's a bubble, all you would do is, there actually is a bubble, all you would do is flick the bubbles out. And then I don't want to squeeze it out because I don't want to get Tylenol everywhere, but you would squeeze the bubble to make sure there's no bubble in the syringe, and then squeeze it out. And then if you needed more, you kind of pull. Whenever you draw up a medication, you're going to want to pull a little bit more than what's prescribed, not a lot, but like a little past. That way, if there is a bubble and you flick it and you have to get an air bubble, you still have the prescribed amount, because you don't. You want to make sure you still have the prescribed amount once the air is out, because you have to get the air bubbles out. So you just need to do your second check and make sure that the dose is correct after the air bubbles and everything are out. Since that is her Tylenol, I'll put that back in there. Now that's the key. Okay, that is how you do it. And like I said, if it's a multi-dose vial, you just want to make sure that you correctly label it. So you want to make sure that you have the date and the time that it was open and the beyond use date, and then you store it based on the facility. Make sure that you do your hand hygiene and proceed the administration based on the prescribed route, whether it's intradermal, intramuscular, or subcutaneous, whatever it may be. Now, as far as mixing medications from 2 vials into the syringe, this is where it gets a little bit tricky. So, when mixing medications, it's similar to just kind of removing medications from a vial, but you still have to do the checks and know, the action of the rights, the appropriateness, and all of that to get the vial, and scrub the top of it still. So you still want to scrub this little top. I'll put my picture back up here. So the vial is still going to kind of look like this. You still want to take this topper off here, scrub this little top, and you would like you would for any vial, after you remove the plastic and the topper and the medication. If a suspension such as NPH insulin, which is kind of like your it's the medication that needs to be rolled and agitated. So it's, and how you agitate, if it's a vaccine or a vial that you draw up, this is how you agitate it and mix it. So you don't actually shake it like this. This is how you would mix it. So this is how you would roll it like this. So that's how you agitate. So you would have to agitate to mix it well if needed. So you scrub the top of it and you let it dry. And once it's mixed, you remove the cap of the needle, and you pull it straight off and you draw back an amount of air that's needed. And then you inject that air into the NPH, which is the first vial that you're going to inject the air into. So you're going to inject it to the NPH insulin first, the air. Then you don't withdraw anything from the NPH. You just take your syringe back out from the NPH. Then you're going to take that same syringe, pull back this amount of air that's needed for the other insulin. You pull the amount of air back. You insert it into the modified insulin, because your NPH is your unmodified. So then you're going to draw back the amount of insulin needed for the modified, and then you hold the modified vial on a flat surface. Then you're going to pierce the sealed stopper in the middle, so this little sealed stopper, like we talked about before, okay, in the center with the needle, and then you're going to inject the measured amount of air into the space above the solution. So just to be clear, the NPH insulin is the unmodified insulin. So the way I like to remember that is NPH is unmodified. NPH is inject air now. N for now. NPH, inject air now, because it is the unmodified insulin. Since it's unmodified, you need to add the air to make it modified. Okay? So NPH, unmodified, add the air. So you added the air, that's all you do. Then you add the air to the modified insulin. Then you're going to add it always add it above. Don't add it to the solution, add it above the solution. Once you add it above the solution, then you're going to invert the insulin again, like we did before. So I'll go ahead and put my picture back up. You're going to invert, like this, the solution, withdraw the amount of insulin needed that was ordered, and then you're going to, once you withdraw the amount of insulin that was ordered, you're going to take it and you're going to take it back on a flat surface, and you're going to take your needle back out, and then you're going to check the amount to make sure it was the correct amount that was supposed to be withdrawn. And if it is, then you're going to take it and you're going to put it back into the NPH vial, and then you're going to withdraw, or you're going to stick it into the NPH vial, turn that over, but you have to be very, very careful not to put any of the the insulin that is currently in your syringe into the NPH, because you do not want any of the modified to go into the unmodified. So you have to be super careful not to push any of that insulin into the other. So you have to hold it and just carefully withdraw the insulin once you invert it, and then slowly take it out once you re-invert it, and then double check again. So this one actually has more than 3 checks. It says you only need 3 checks, but there's really, I feel like, 6 checks here, because you need to check it after everything to make sure your doses are correct. So you check it again to make sure your dose is correct, and then that is how you mix it into the vial. It seems a little bit complicated, but the vial will also need to be labeled with the date and the time that it was opened, the beyond use date, for it to be stored, and the vials containing the remaining medication according to the facility policy. And then you need to lock the supply system before leaving and perform hand hygiene, administer the medication as ordered, whether it be whatever the doctor ordered. Also, that means that you would just need to, check the orders and do all that stuff again, to do all your system checks with the patient, and just make sure that you do the hand hygiene before administering the medication.